name's Kathy Billiter, and I'm the president of the local union, nurses union here, National Nurses United, and we're having a Main Street rally to promote NNU's Main Street agenda. Nurses across America are uniting today. Over 60 events in over 21 states are going on today because we have united because we want to heal America. And one of the agendas that we want to do is we want to pass a law having a tax on transactions on Wall Street so that it can raise money for some of the funds. But the Main Street agenda, this is our agenda, and what they're looking for is jobs at living wages for all, guaranteed health care for all, a secure retirement. We want people to have equal access to education, good housing, a safe, healthy environment, and a just taxation system where corporations and wealthy pay their fair share. We feel like everyone's focusing on Main Street, and people in Congress need to get down to the grassroots level and start focusing on the people on Main Street, the people that are hurting and doing without food or doing without health care, doing without jobs. These are where we need to put our focus. So nurses are banding together, and we're going to promote this.
Did you talk to your representative, Paul Brown?
Paul Brown, all of the representatives locally received information about our Main Street agenda, and most have been very supportive of this. We're still working to get Saxby-Chambliss to sign on, and we're encouraging all the people around here to encourage him to sign on with us. But Paul Brown and John Barrow and such have been very supportive of the NNU and their agenda.
Hi, I'm Terrence Dix, and I'm with the Progressive Democrats of America. I'm also through labor a member of Working America, and we're here in support of the National Nurses Union, and we're really glad that they're making this move. We fully endorse the Main Street contract. We really need it very badly. We are so glad to know that these folks who are working hard in different theaters all over the country, working in different hospitals, different organizations, and they're working real hard. And they just want to make sure that their kids and grandparents and everybody's taken care of, and to make sure that working people get what they're supposed to get, and not just the folks on Wall Street. We're asking that people remember that corporations are not people. They are not people. And just like Kathy Sign says here, we want to heal America by taxing Wall Street and making sure that people pay their fair share just like everybody else is paying their fair share. So thank you so much, and we're really glad that people are coming out here today in beautiful Augusta, Georgia to support this effort.
I'm speaking on behalf of Raymond Hockenberry. He is the president of the Augusta Central Labor Council. He wanted to be here tonight, but he had a previously scheduled meeting, their regular monthly meeting of several unions in the Augusta area. He extends his welcome and wants you to know that the Central Labor Council of Augusta supports National Nurses United and our Main Street agenda.
The next speaker will be Irma Westmoreland. The nurses here all know Irma. She was the president of our local union, but now she is the national chairperson of our National VA Council under National Nurses United.
We're here to call on Senator Chambliss to sign a pledge to support a tax on Wall Street financial speculation to provide the money we need to heal America. To ask him, which side are you on, Wall Street's or Main Street's? It's the same question we're asking more than 60 legislators in their home offices in 21 states across the nation today. America's nurses are alarmed. We see broad declines in health and living standards among our patients, their families, and our communities. Declines that are caused by a lack of jobs, people suffering from poor nutrition, people who are losing their homes or their entire retirement savings. Here in Georgia, we have a 10% unemployment rate. Greater than 19% of Georgia citizens are uninsured. Greater than 20,000 people are homeless. 15% of Georgia citizens live in poverty. To make that number more real, about 114,000 seniors, our parents and grandparents, live in poverty. Greater than 500,000 of our children live in poverty. What can you expect when the income of citizens of Georgia reduced to just over $25,000 per person? I'm sure you will not be surprised to hear that in the first quarter of 2011, Georgia ranked 6th in the United States for highest foreclosure rates on our homes. We're here because we will no longer be silent about our patients who refuse life-saving medical treatment or reject diagnostic procedures or postpone taking medications because they can't afford them, the high co-pays, or even the deductibles. We're here because we see the crisis in our own families, spouses, adult children, brothers and sisters who can't find jobs or who can't get health insurance. Even in my own family, my 22-year-old daughter, Jenna, works in a job where she does not have health insurance. When she got married last year, she had to come off my federal health care plan. Her husband's job does not provide health insurance either. Earlier this year, Jenna got sick and she had an infection that early antibiotics would have easily cured. She didn't go to the doctor because she couldn't afford the cost. That sounds real, doesn't it? That's what happens to everybody. She finally was hospitalized because the infection got so bad she needed IV antibiotics. The cost of this hospital bill, lost work days, pain, suffering, and the negative effects of a severe infection could have been avoided if she'd had health insurance. I'm sorry to say my daughter's story is not unusual in our community or across America today. We're here because Washington has largely abandoned our communities. Too many politicians would rather cut programs that help people than take the steps we need to claim the American dream. That's why we're fighting for a Main Street contract for the American people. A contract that would mean jobs at living wages, health care for all, good schools for our children, protection from homelessness and hunger, and a secure retirement for everyone. The disruption and dislocation many of us just saw from Hurricane Irene is what many Americans experience every day. There is an economic storm flattening America, and the eye of the storm is Wall Street. We're here because Wall Street got bailed out and Main Street was left out. We're here because soup kitchens and homeless shelters should not be the fastest growing business in America. That's right. We're here because medical bills should not be the leading cause of bankruptcy because people don't have health insurance. We're here because our politicians should care more about jobs than giving handouts and handouts and more handouts to Wall Street. Big banks, investment houses, and other financial giants who have wrecked our economy, who gambled with our mortgages and pensions, need to return some of that enormous wealth to Main Street. It's time to take it back. The nurses have a plan. The plan is a tax on Wall Street. The financial speculations that could raise billions of dollars to fund the programs we need to put Americans back to work, to support our families, protect our homes, our schools, and our health. We propose a sales tax, a very small, minute amount, on all major Wall Street financial activity, such as the billion-dollar gambling that is done on dividends, the credit default swaps, and the futures that put our economy in ruin. The fastest growing markets in the world, like Great Britain, already have such a tax like the one NNU's calling for. Our legislators will tell you that they don't want this tax because it's going to ruin our economy. But you know what? Great Britain has had it forever, and it hasn't done anything to them. But what it could do, they're afraid for you to hear, is to raise the millions of dollars and billions of dollars we need to fund our American health care and to put jobs on the street, and they don't want it. They do not want you to know that there is a way that they can stop hiding behind tax shelters and pay their fair share. Because let me tell you, I pay my fair share, and so do you, and so does the rest of America. Main Street America pays their fair share, but billionaires and people with these corporations that stand behind tax shelters do not pay. And we need those people to understand that we're here as Main Street Americans to take back America. Even conservative leaders, including the President of France and the Premier of Germany, have proposed a financial speculations tax for all of America. Why should we be left out again and left behind again and be trailing behind these other countries with answers when they've already had them to fix problems? We need to be a leader and not the last one to get on board. We ask you to join us as we fight for a Main Street contract for the American people. We need to heal America and tax Wall Street. We need to take back America and demand living wage jobs, health care, housing, quality education, and a secure retirement for all Americans.
Letitia has been an activist, has an activist background, and she is disabled, and she's been very active in the programs to help with the disabled Americans. And you know, she's having trouble herself with this economy, so she wants to share her story and tell you all about it.
I'm a graduate of East Carolina University College of Nursing. I've been a nurse for 2 years, and I'm currently working at the Charlie Norwood VA Medical Center, serving those that have served me and my country. I'm here today to briefly describe to you how the economy has impacted me, myself. When I was in nursing school, my mother, she was a pedestrian and she got hit by a car. And because of the poverty level and not a lot of money and no job, I had to quit nursing school so that I could get a job, 2 jobs, to bury my mother. And that was a major impact on me because I had already had enough obstacles to face. They didn't have a lot of scholarships in school so that I could finish school and contribute and be a productive citizen of America. And I'm standing here today just to let y'all know that we as nurses, we have dedicated and committed ourselves to advocating for our patients. And I encourage each one of y'all to continue to come out in large numbers, because together we stand and divided we fall. Our patients who we see every day, some are homeless, some don't have affordable health care, some don't have jobs, their kids don't have jobs, they have families staying with them, 2 and 3 different families. And you know, it saddens my heart because I serve a group of people that have served this country, and coming back I feel like we should serve them as well. So as nurses and everyone else here, I'm asking y'all to continue to come out and stand and say, let's tax Wall Street and bring the money back to Main Street. And always remember that anything you plan in faith, please don't give up in doubt. Continue to hold on and come together in numbers and fight this fight to heal America. And again, thank you.
I really believe that everyone should have access to safe and affordable health care. I wanted to share a story about a friend of ours, and he is affectionately known as the General. He is a colorful downtown character, and he befriended us, my husband and I, my family. He has accepted us as a friend, and the General loves to live life on his terms and how he wants to live it and where he wants to live it. His life was rolling around just fine until 4 months ago. The General fell one night and knew he was in real trouble when he could not get back onto his bicycle. He called my husband and asked for a ride to his room in the warehouse where he sleeps. My husband asked me to look at the General's legs because the General could not bear his own weight. His left thigh was swollen and bruised, and being the wonderful x-ray machine that I am, I said, "Your hip is broken." We tried to get the General to go to the local ER at MCG, and he refused. As weeks went by, his pain increased and he could only get around on a pair of crutches that he had scrounged somewhere downtown. After a few weeks of witnessing this man's limited mobility and his pain, we asked him why he wouldn't let us take him to the ER. He finally admitted to us that he could not pay for his health care. He had no health insurance, no retirement, no pension, and he felt that he would be turned away because he had no way of paying a medical bill. I talked to him and told him that there were indigent health care programs here in the city of Augusta and that he would be eligible. After a while, he finally agreed to let my husband take him to the emergency room. When he went to the ER, he was diagnosed with a fractured femur and was scheduled for surgery the next day. After a few days, the general called us and he was upset. He said, the doctor said, I'm ready to go home. And I asked him, what did he mean? I said, you still have a surgical dressing. You are not ready to go home. I said, did you tell the doctors that you live in a warehouse that has no shower, no bath? He said, yes, but that didn't matter. So my husband and I went down to the hospital unit where he was staying, and we spoke with the nurse, asked to speak to his doctors. They were not available. We asked to speak to this man's social worker, and she was not available, but she did call me the next day. And I explained to her that the general's living conditions, and she said, well, he won't qualify for a nursing home because he doesn't make enough income and he has no Medicaid. So I pointed out to her that the Salvation Army did have a small unit that could take care of indigent people. It's a small little hospice, I should say rehab unit, and that's where the general got to stay for the next 14 days. The general is not able to come and share his story on his own because he is still recuperating. He lost a lot of weight and he is very weak. It's very frustrating to me to think that our society can spend millions and millions of dollars bailing out Wall Street, but we can't spend a few thousands of dollars on our own citizens, no matter what the age, situation. It is very distressing. So I just thought I'd share that story with you.
Ooh, I like this one.
Okay.
Thank you.
This right here, it says corporations are not people.
I like this. I like this. Hands off Medicaid. Hands off. Right.
All right, everybody say hands off Medicare.
Hands off Medicare.
Beautiful.
All right.
AnibalShow.com